For those bumps and bruises you got on the playground as a kid, well, chances are it was a school nurse who helped you feel better.
But now there's a gap in that critical care, and as our Maria Cade shows us, one organization's mission is to fill it.
Your child's school doesn't have nurses. Teachers become first responders to everything, from asthma attacks to playground injuries.
I have been a nurse for 45 years, I think. 45 years.
Less than 40% of the nation's public schools employ a full-time registered nurse. That's where the Visiting Nurse Association and nurses like Nancy Paris come in. Her journey as a nurse isn't linear.
My name is Nancy.
She worked in obstetrics for years before teaching future nurses. Now,
And I work as a school nurse for Brown & Talbot.
she's in the school twice a week, working through the VNA. In 2024, nurses like Nancy served nearly 24,000 students across 63 participating schools in the metro, including Bennington and Elkhorn school districts. Nurses give medications, check up your students when needed, but also train staff when they aren't in the building.
Because we don't have them full-time on staff, that really ensures the safety of our staff and students while they're not here.
Julie Smith is the chief academic officer at the school. She says the nurses are also vital in helping with vision and hearing screenings. At Brownell, VNA staff have been doing this for more than 30 years. Smith says she can't even remember how the school operated before then.
I don't think it's an option for us not to have a nurse. It's such a peace of mind for our parents and a peace of mind for our staff when we know how to deal with things.
Paris says having a nurse in school doesn't just benefit your kids in that moment of need.
When I was in high school, the school nurse there was a full-time, and she was an influence to what I wanted to do for a lifetime.
So the next time your kid gets those inevitable bumps and bruises, there's someone there to help them heal and maybe even inspire their future, just like Nancy was. In Omaha, Maria Cade, First Alert 6.
Brown & Talbot is in the process of expanding with construction on a brand new building happening now. Smith says if enrollment numbers grow, they might need to bring in another nurse for more hours.
As the lead